Hey everyone, welcome back to Speak Healthy. If it's your first time here, please be sure to subscribe for more content to help you live a healthier life. Today, we're going to talk about some of the little known dangers to drinking excess water, especially for those of you over age 50. Before that, please be sure to click the link down below in the description for a powerful juice that will get you feeling younger and leaner within weeks. Communities with long-living men and women have been consuming the ingredients in this juice for generations to live longer and healthier lives. Now, let's dive in. As we age, our bodies undergo numerous changes, including alterations in our fluid balance. Staying hydrated is essential for maintaining optimal health, but it's equally important to understand the potential risks of drinking too much water, especially as we grow older. While it's commonly believed that drinking plenty of water is always good for us, consuming an excess amount of water when you're elderly can have negative consequences. These are the top 9 dangers of drinking too much water after 50. Number 1, water intoxication. The kidneys play a critical role in regulating the body's fluid balance. They filter waste products and excess fluids from the bloodstream and eliminate them from the body through urine. As we age, the kidneys may not function as efficiently as they did when we were younger. This is because the number of nephrons, the filtering units in the kidneys, decreases with age. Additionally, the blood vessels that supply the kidneys with blood may become stiffer and less flexible, which can reduce the kidney's ability to filter fluids. When the kidneys are not functioning as well as they should, excess water can build up in the body, causing a condition called water overload or water intoxication. This can result in hyponatremia, a condition in which the blood becomes diluted and the concentration of sodium in the blood drops to dangerously low levels. Hyponatremia can cause a range of symptoms including nausea, headache, confusion, seizures, and even coma. In severe cases, hyponatremia can be life-threatening. Number 2, hyponatremia. As previously mentioned, hyponatremia is a medical condition that occurs when the concentration of sodium in the blood becomes too diluted. Sodium is an essential electrolyte that helps to regulate fluid balance in the body. When sodium levels become too low, the body cells can swell due to excess water, which can cause a range of symptoms. Drinking excessive amounts of water can be a cause of hyponatremia as it dilutes the sodium in the blood. This is especially true for seniors whose kidneys may not function as efficiently as they once did, making it more difficult for their bodies to excrete excess water. When water is consumed in large quantities, the kidneys may not be able to keep up with the demand, leading to a buildup of excess water in the body. Symptoms of hyponatremia can range from mild to severe and can include nausea, headache, confusion, seizures, and even coma. Mild hyponatremia may not cause any noticeable symptoms, but more severe cases can be life-threatening. Older adults are particularly at risk of developing hyponatremia as their bodies may be less able to cope with changes in fluid balance. Number 3, heart failure. Heart failure is a condition in which the heart is unable to pump blood effectively throughout the body. This can lead to a range of symptoms including shortness of breath, fatigue, and swelling in the legs and feet. As we age, the risk of developing heart failure increases, and seniors with existing heart conditions are particularly vulnerable. Drinking excessive amounts of water can put additional stress on the heart, especially if it's already compromised due to heart failure or other heart conditions. When the body is overloaded with water, the heart has to work harder to pump blood through the body, which can lead to increased strain on the heart muscle. Over time, this can contribute to further damage on the heart, worsening heart failure symptoms and increasing the risk of other heart-related complications. Number 4, urinary incontinence. Urinary incontinence is a common problem among older adults, particularly women. It's a condition in which an individual experiences involuntary leakage of urine, which can be embarrassing and have a significant impact on daily life. Many factors can contribute to the urinary incontinence, including aging, weakened pelvic floor muscles, and certain medical conditions. Drinking excess water can also contribute to urinary incontinence, as it can increase the frequency and urgency of urination. This can be particularly difficult for elderly individuals who may already have issues with bladder control. Drinking excessive amounts of water can also cause the bladder to become overly full, putting additional pressure on the bladder and increasing the risk of leakage. Number 5. Adverse effects from medications. As we age, it's common to require multiple medications to manage chronic health conditions. Unfortunately, some medications can interact with excess water intake, leading to potentially harmful side effects. For example, certain medications used to treat high blood pressure, such as diuretics, can increase the risk of dehydration and electrolyte imbalances when combined with excessive fluid intake. Other medications, such as those used to treat heart failure or kidney disease, may require careful monitoring of fluid intake to prevent complications. When an individual takes these medications and drinks excessive amounts of water, it can lead to an imbalance of fluids and electrolytes in the body, which can cause a range of symptoms such as fatigue, dizziness, and confusion. If you're learning a lot so far, please be sure to subscribe to Speak Healthy for more useful content on how to live fuller and healthier lives. Number 6. Edema. Edema is a condition that occurs when excess fluid builds up in the body's tissues, causing swelling and discomfort. Drinking excessive amounts of water can contribute to edema by overwhelming the body's natural fluid balance mechanisms, leading to an accumulation of fluid in the tissues. For elderly individuals, edema can be particularly problematic, as they may already have weakened or swollen limbs due to underlying health conditions or lifestyle factors. The additional fluid caused by excessive water intake can exacerbate these symptoms, making it difficult for seniors to move around comfortably and perform daily activities. Number 7. Electrolyte imbalances. Electrolytes are minerals that are essential for a variety of bodily functions, including nerve and muscle function, fluid balance, and heart health. Sodium, potassium, and chloride are among the most important electrolytes in the body, and imbalances in these minerals can cause a range of symptoms and health problems. Drinking excessive amounts of water can lead to electrolyte imbalances by diluting the concentration of electrolytes in the body. This can be particularly problematic for elderly individuals who may already be at increased risk of electrolyte imbalances due to age-related changes in kidney function or underlying health conditions. Symptoms of electrolyte imbalances can include muscle weakness, cramping, fatigue, and irregular heartbeats. In severe cases, electrolyte imbalances can lead to seizures, coma, and even death. Number 8. Cognitive impairment. While rare, drinking excessive amounts of water can cause cerebral edema, a condition where fluid builds up in the brain. Cerebral edema can be particularly problematic for elderly individuals, as they may already be at increased risk of cognitive impairment due to age-related changes in brain function. Symptoms of cerebral edema can include headaches, nausea, seizures, confusion, and even coma. In severe cases, cerebral edema can be life-threatening. Seniors should be aware of the signs and symptoms of cerebral edema and seek medical attention promptly if they experience any of these symptoms. Treatment may involve reducing fluid intake, using medications to reduce swelling in the brain, or other interventions depending on the severity of the condition. Before we go over the final complication of drinking water in excess, please be sure to check the link below to learn more about the anti-aging benefits of Ikaria Juice. Number 9. Altered bowel function. Drinking excessive amounts of water can interfere with normal bowel function, particularly in elderly individuals who may already have issues with bowel regularity. While water is essential for maintaining healthy bowel function, excessive water intake can cause a variety of gastrointestinal symptoms, including diarrhea, nausea, and bloating. This is because drinking too much water can cause the intestines to become over-diluted, leading to a laxative effect that can result in diarrhea. On the other hand, drinking too little water can lead to constipation, as the stool becomes dry and difficult to pass. Elderly individuals are particularly susceptible to constipation, as age-related changes in the digestive system can slow down bowel movements and make them less effective. To maintain healthy bowel function, seniors should aim for a balanced fluid intake that meets their individual needs. Healthcare professionals may recommend a specific fluid intake goal based on an individual's health status and bowel habits. Well, we hope you've learned something new today. Please don't forget to subscribe and like this video. See you again next time.